Hey everyone, good evening. This is Dr. Rohini, and after a break, we are starting with the MCQ series again. We had the MCQ series sometime back where we had a lot of viewers, and again, I'm back with MCQ series where we are going to watch a lot of gross anatomy questions, and we are going to discuss all these, and then later on we'll also do some topic based discussions in special classes. So today we are going to start with the mixed MCQs. So this is a new series that I have started. Instead of training you with just one part of the anatomy, I thought we'll put everything together, and this is going to be a mixed MCQ where you're going to answer from different aspects of anatomy. So upper limb, lower limb, head and neck, everything is mixed up, including the neuroanatomy. Right. So today we are going to start with some more new things that has been put up from Unacademy platform. And before all that, let me just introduce myself to you. I'm Dr. Rohini, and I'm an alumni from Kasturba Medical College, and I also have the additional qualifications along with my master's degree. I have medical transcription degree and also the MBA in hospital administration. Because I also run a hospital. That's the reason I have a hospital administration degree as well. And I also have the PhD from Savita University. This is at Chennai. This is from Chennai. And there is one more interesting thing that you can see, that is an embryologist course, that is a certificate course in ART, assisted reproductive technique. So if you are very interested in gynecology and you want to pursue gynecology, please go ahead. Along with that, you also do ART course, that is assisted reproductive technique once again. So where you are going to learn more about the ICSI and IVF. So this is going to give you more job opportunities abroad. So this is also something that has been catching up in the market really well. So don't forget to try this new course. This is just, 6 months to 1 year course. So it is not going to be tough at all. And if you are already versed with the medical degree, then it's not going to be tough at all. So you may also have, students who have joined from biotechnology background as well. So you may have many other background people also, but a lot of importance is going to be given to the medicos. All right, with so many years of experience, about 10 years of experience, I would be counseling the students from PhD as well, not just PhD. I'm also a good counselor for the other aspirants like the NEET aspirants, FMG, PLAB, USMLE, etc. And I also teach the aspirants from all these backgrounds. So with so many years of experience, I would feel very blessed and happy to be at Unacademy platform today. So this is my referral code, ROHINI. So if you are a YouTube user like this, you could use this code. And what is the use of code? If you ask me, the use of code is to get all access to these free products. So free products includes all these special classes, quizzes, and tests. So you can go look up my profile. So my profile has this name. So this name is very much seen there along with the profile picture, and also you can search for me using this username Aqua. So when you search for this username by going to the app store where you can download the Unacademy Learners app, and then you can go to the NEET PG section, you will be able to access the classes of all the educators. So all these are actually free classes. So if you want in-depth classes, you have to subscribe, and also you have to look up for other options like the plus classes where you have the entire curriculum that is, done. So let me show you some of the curriculum that we have for long-term subscription. So these are some of the beneficiaries. So who have, dedicated their hard-earned minutes, that is by watching the videos and the educational, lectures that is being put up by these educators. So we have blue hat, red hat, brown hat, and all these are the hard-earned hats that is dedicated to their favorite educator. I have many more in my copy. So you can go look up my profile, Rohini Wine, and you can also follow and subscribe. So when you follow and subscribe, you get notifications of all the classes, then you're not going to miss a thing. So please subscribe and follow. And this is one plus subscription. So your access to the best of Unacademy can be with the plus subscription only. So where you can have daily live classes, structured courses, everything is neatly defined, structured courses where you are not going to miss out anything, because even if you miss something, you can refer to the recorded versions. So that is always available. You always get this PDF notes that you have access to. And there are a lot of test series and quizzes. So where you know exactly where you stand, how much you have understood, everything can be accessed. And one more nice thing is you have unlimited access. So you need not think that just with one, view, you are done with that particular chapter. You want to watch over and over again, and you want to, watch it during your comfortable time, you can definitely do it. Okay, we also have this iconic subscription where the best of Unacademy and best of Prep Ladder is available. This is the iconic subscription where you have both of them, and you have live classes, videos, quizzes, etc. Sorry about that. All right. Okay, so this is limited time offer where you can see there is NEET PG iconic subscription. 36 months of subscription is just for 58,500, which was 92 before. It is just 58,500, where you can get 10% discount. If you are the first 500, get the discount as well. You can also see that MetMind scholarship test, where there is this topic that is put up, and you are going to take the test at 8 p.m. on 10th of July, which is pre-decided. So you have a big chance of winning something. So you can win many things. If you're a first rank holder, you get the 100% subscription scholarship value for 1 year. And if you're between second and fourth rank, then you get 75 scholarship. And if you're between 5 and 9, you get 50% scholarship on 6th, 12th, 18th, and 24-month subscription. So you get all these things if you take up this test on 10th of July at 8 p.m. So other than that, you also have some more ranks 10 to 19. We get to avail 25% scholarship on these subscriptions. So it is a very nice offer. You get to save money, and you can also test your knowledge with this test. And there is something more, that is boost your INICT NEET PG 2021 preparation with this 3+1 offer, where the 30 days subscription is added within a month. So this is also similar, 12 months, 2 months is free. So the 30 days itself, you'll get the free 2 months added to your 12 months. So it will become 12 plus 2, 14 months of subscription. That's really good number of, months to prepare. So when you feel you want to access all these, please do check out our website and you please look up for the app. It is Unacademy Learners app where you can get all the details. Once you register, you will be able to watch all the details. And you also have this new thing that is 4 years subscription. So 4 years subscription is for medical aspirants from their foundation to NEET PG. So if you're still in UG, you still can make a very good foundation for yourself with all the preclinical, paraclinical, and clinical based learning with the INR 60,000 and iconic subscriptions 75,000, where you have the access to prep ladder as well. And all this you can avail. Use the code. Don't forget to use the code. Okay, you use the code to get 10% additional discount. So don't forget to use the code whenever you subscribe. So you also have a new feature, raise your hand. So when you raise your hand, you will be able to ask your query. You can ask your query, we can pause and answer your query. So this way, you will have personalized and highly interactive live class experience. So even though it's an online experience, you will get the feel of offline as well because the educator is directly interacting with the individual. So it's a very nice experience and you would be solving your queries then and there and you don't have to take it to your other class. So this is integrated clinical batch on 30th starting and clinical batch that is starting on 30th. So dual educator sessions are present and also we have exclusively clinical subjects we have. So all this is starting from the 30th of June. So don't forget to subscribe and log in and also look up for all this marathon high yield topic wise revision. So this is really going to boost your knowledge and give you loads and tons of knowledge. So NEET PG high yield revision batch is also available. That's starting from the 30th of June 2021. Okay, where you have topic wise revisions and interactive sessions, everything that is with the top educators. And you have NEET PG seasons batch that is started on 30th June. So all this is just begin. You can go ahead and enroll yourself and target next 2022, that is from June to January, which is an evening batch because many people feel that they're not having so much time during the daytime, so you can go for evening classes as well. So this is one thing. And then there is Focus FMGE batch, which is started on 30th itself. And this has interactive classes with the top educators, in-depth learning, test series, double doubt clearing sessions, integrated approach for all the topics. And if you miss any class, don't worry, it is the recorded sessions are available upon your request. And also PDF notes you can collect. So what else do you want? Everything is available under one roof, this Unacademy. So you also have this option of EMI. So if in case you think the amount is something that you can't afford to at once, you can go for EMI option. With minimum of 6 months, you can go for EMI. Don't forget to use the code ROHINI. That's my name itself. You can use this code and avail the EMI option, which is no cost EMI with minimum of 4 months subscription. So here you will get for 48 months only 1,125 rupees. This is really, really, cost effective. And also the student will get motivated because every month you're paying a little amount and you will be, motivated to do better. So this is the code that you need to use. You can also use this code to gift others the gift of education. So you can send the code, you can ask them to enroll, or you can gift them a year of subscription as well. So with all these things, this is the first class I'm going to start in the month of July. So we are going to start with mixed MCQs. So this is what we are starting today. First one, let's start with all are true regarding axillary artery except. So we are talking about the axillary artery. Okay, let's see if there is anyone who is. Okay, all are true regarding the axillary artery except. So what is the thing that is not correct except? So this is what you're supposed to answer. Is it a continuation of the subclavian artery? Is it a continuation? Yes. Okay, so beyond the level of outer border of first rib, it is axillary artery. So is a continuation definitely. And then is it crossed by pectoralis minor muscle? Is it crossed by pectoralis minor muscle? It is crossed by, yes. So it divides this axillary artery into three parts. That is also true. The third one, it extends from the outer border of second rib. Is this a correct thing? Is it a second rib or the first rib? So it should have been outer border of first rib, but here it is mentioned as second rib. So you have to read the answers and options very, very clearly. So sometimes the options are very misleading and there will be slight, changes in manipulating the options. So you have to read it very clearly, not just assume. The second part of axillary artery is posterior to the pectoralis minor muscle. So this is also correct. So the answer would be C. Okay, the answer is C because this is the axillary artery. You can see the clavicle and you can see the rib. You cannot see very well. You have to assume there is this first rib and you can see this pectoralis minor. This is the pectoralis minor. This is the major and this is minor and it goes to the coracoid process. And where is it coming from? It is coming from the third, fourth and fifth ribs. Okay, pectoralis minor. So pectoralis minor actually divides this axillary artery into three parts. So you can see that it crosses the axillary artery and first part is superior to the muscle. Second part is what is posterior to the muscle and you have the third part that is inferior to the muscle. Okay, so that is the third part and the second part is right below the pectoralis minor. So you have to remember this muscle name and also remember the first rib. So if you remember these two particular landmarks, you'll be able to answer this question. It extends from the outer border of the second rib to the lower border of the teres minor. So there is this muscle teres major and minor and these two are very important landmarks for the ending of the axillary artery and beginning of the brachial artery. Okay, beyond this teres minor, the brachial artery would begin. Okay, next question. Okay, is there anyone who can answer this question? Which of the following muscle is supplied by the anterior division of mandibular nerve? Now, mandibular nerve they're talking about. First of all, we have to think mandibular is a branch of which one? Mandibular is a branch of trigeminal. And it gives anterior division and the posterior division. So here the options are the lateral pterygoid, medial pterygoid, mylohyoid, anterior belly of digastric. So which of the following muscle is supplied by anterior division of mandibular nerve? So anterior division has mainly muscular branches and only one sensory branch, that is buccal. So we have to think what are the branches that it gives from the anterior division. They're not talking about the trunk. So we have to remember they're talking about anterior division. So obviously it has posterior division also. So let's go for the options. We just have to remember what is A, B, C and D. Okay. So let's see. The correct answer is B, lateral pterygoid muscle. So lateral pterygoid muscle. Why not A? Let's see. First of all, the anterior division of mandibular nerve supplies the lateral pterygoid, masseter temporalis. Now, what about the other muscle, that is medial pterygoid? Here in the options, masseter was not given. The temporalis was not given. The only option it had was the lateral pterygoid. That's why the answer lateral pterygoid. But what about medial pterygoid? Why this is not supplied by anterior division? And who supplies the medial pterygoid otherwise? So it is the medial pterygoid is supplied by nerve to medial pterygoid, which arises from the main trunk. So if you remember the mandibular nerve, this is the ovale. It exits out here like this, and this is the trunk. So here you have the anterior division and posterior division. So anterior division has all these three. That is, it supplies lateral pterygoid, it supplies masseter, and it supplies temporalis. Plus, it has one buccal branch. Okay. But the trunk has two branches. We'll talk about the trunk. What are the branches of the trunk? Trunk has the medial pterygoid nerve to medial pterygoid, it is called otherwise, and also another one which is called nervus spinosus or meningeal branch. This is called meningeal branch. So this, you remember it is from the trunk. So this one is from the trunk. So this one is from the trunk. This one is from the trunk. Along with this, it not just supplies the medial pterygoid, but it also supplies one more muscle called the tensor tympani. All right. So this is what is the supply of the trunk. Now coming to the posterior division. So you remember posterior has all sensory. The anterior is muscular. Posterior is all sensory. You remember ALI. This is auriculotemporal. This is lingual. This is inferior alveolar. These are the branches from the posterior division. All right, let's see if there is anybody. Okay. So this mylohyoid and the anterior belly of digastric, both of them are supplied by the inferior alveolar nerve. So this is very important. So this inferior alveolar, what we have marked is supplies, not just that, it also supplies the mylohyoid. And also the anterior belly of digastric. So it's very important. Anterior belly of digastric is supplied by which one is very, very important question. It is supplied by the posterior branch because posterior has all sensory except one muscular, and anterior has all muscular except one. It's just the opposite. Okay, so you remember it that way. So here you can see the trigeminal, you can see the mandibular trunk, then how it exits out through foramen ovale, then all these branches you can see. All right, that is mandibular nerve. So it also gives this inferior alveolar and many other branches. So inferior alveolar is a very pretty thick branch from the posterior trunk. All that you can identify. Okay, next one. Regarding the ansa cervicalis. Now, what is this ansa cervicalis? Where is it? Now, you must have seen this carotid sheath. Okay, carotid sheath relations, if you take, there are actually three compartment like things, and the medial most one has the internal carotid artery. Last one, this is internal jugular vein, and the middle portion has vagus nerve. So this is the relation of the carotid sheath. This is the carotid sheath. Now here you can see that anteriorly it has ansa cervicalis, and posteriorly sympathetic chain. Posteriorly, it is related to sympathetic chain, and anteriorly, you have the ansa cervicalis. So this is something that is very interesting. So here, most of the time, the question that is asked is, what is the lateral most structure in the carotid sheath? The lateral most structure in the carotid sheath is internal jugular vein. So this is a very important point. Now here, the question is, regarding ansa cervicalis, all are true except, so what is that except thing? Everything is true, all the statements are true. What is not true? Superior root is continuation of the descending part of hypoglossal. Inferior root is derived from fourth cervical spinal nerve. Is that the answer? Now, supplies the sternohyoid muscle. It lies embedded in the anterior wall of the carotid sheath. So all of them are true except one. So this is the correct answer. Now let's see what other correct answers are there and what is that one thing that is the wrong statement. So please look at the options. First, second, third and the fourth one, A, B, C, D. And this is the answer, the B, that is inferior root. There is a superior root and a inferior root is derived from fourth cervical spinal nerve. Is this a correct thing? It is not the correct thing. So inferior one is from the descending cervical. Okay, that is the correction that you need to make. So now there is a superior root that you can see and there is an inferior root. So you can see the inferior root, how it is formed. It is formed here. This is the descending cervical, which is formed by the C2 and the C3. All right. So this is the ansa cervicalis. So this is actually cervical plexus that you can identify C1, C2, C3. So C4 onwards is, contributing to the brachial plexus. So this is the superior root and inferior root. Descending cervical, you should see, this is the inferior root. And this is the branch from the first cervical to hypoglossal, which extends a branch to the hypoglossal nerve that forms the superior root. So this is the superior root, right? Descending hypoglossal it is called. And then you can see that ansa cervicalis is very thin nerve loop that is embedded in the anterior wall of the carotid sheath, and it supplies all these muscles. It supplies all these, like you can see that sternohyoid, sternothyroid, and inferior belly of omohyoid. These are some of the muscles. So don't get confused with the stylohyoid. This is sternohyoid. So these are all the infrahyoid muscles. How do you remember the infrahyoid muscles? So suprahyoid and infrahyoid you can remember by using the mnemonics. Supra you can remember by MSGD, and infrahyoid you can remember by TOSS. So these are the muscles. You have sternohyoid, sternothyroid, omohyoid, and thyrohyoid. So these are some of the infrahyoid muscles which is supplied by the ansa cervicalis. All right. So now fibers of the superior root are derived from first cervical, that is C1. You can see this C1, how it extends a branch to the hypoglossal nerve, and this is called the descending hypoglossal. Next, fourth one, roof of the fourth ventricle. Now, roof of the fourth ventricle. So there is roof of the fourth ventricle and there is floor of the fourth ventricle. We're talking about the roof of the fourth ventricle. Floor is also called the this one, the fossa, the rhomboid fossa. Here we are talking about the roof of the fourth ventricle. So here it is formed by all of the following, except which one does not form part of the roof of the fourth ventricle. So is it inferior medullary velum? So there is something like this which forms an apex-like thing. There is inferior medullary and superior medullary. This is superior, this is inferior, and it also has this obex. So, but where is this median eminence? Median eminence is not part of the roof of the fourth ventricle. Roof of the fourth ventricle also has this choroid plexus. So we have to look at the options first and then let's see whether the answer is correct. The answer is the median eminence. Where is this median eminence seen? It is not seen in the roof. It is seen in the floor of the fourth ventricle. The floor of the fourth ventricle, I mentioned that it is also known as rhomboid fossa. And it is divided into two triangles. There is a hypoglossal and a vagal triangle. Two triangles are present. So that is rhomboid fossa, and that is where you will see an eminence called median eminence. So this will be the roof, and this will be the floor. So this portion is the floor. Okay. So this floor actually consists of this triangle and also the hypoglossal and the vagal nerve. They emerge from there. So now here roof of the floor fourth ventricle is formed by what structures? What structures actually form the roof of the fourth ventricle? So you can see that there is this medullary velum, superior and inferior medullary velums, and you can see there is superior cerebellar peduncle, and you can also see the tila choroidea, which is nothing but the choroid plexus that forms in the roof of the fourth ventricle. And there is tinea with obex, that is a point in the fourth ventricle. So these are the structures that you can see in the roof, the fourth ventricle. Okay, the floor is the one which is on the very closely related to the pons. Next one. Branch arises from the main trunk of mandibular nervus. Now, mandibular nerve, we have spoken about it in the previous slide. So here they're talking about the branch that arises from the main trunk. So I told you the mandibular nerve exits out and it forms the trunk. Then you can see it gives an anterior branch and a posterior branch. Now they're asking about this trunk. This is ovale. The branch that arises from the main trunk of the mandibular nerve is it nerve to medial pterygoid? Is it nerve to lateral pterygoid? Buccal? Auriculotemporal. So let's just revise, just quickly think because we just discussed it in the previous slide. Let's see whether we can recall. So now here, let's start from D. Now, auriculotemporal, is it sensory or motor? It is purely sensory. What does it supply? It supplies the TM joint and also parotid gland. All right. Next, there is this buccal nerve. Buccal nerve supplies the skin around the cheek. That is near the angle of mandible. This is the buccal, that is angle and ramus of the mandible is supplied by buccal nerve, which is nothing but a branch from the anterior trunk. Anterior branch. Next, there is nerve to lateral pterygoid. This is also from the anterior. It is not from the trunk. Next, coming to medial pterygoid. Medial pterygoid is supplied by the main trunk itself, and the trunk supplies the medial pterygoid plus tensor, belly, palatini, muscle. Two things it supplies. It supplies the two things. These two are supplied by the trunk itself. Let's see the same diagram. You can see the trigeminal, you can see the inferior alveolar, you can see the lingual branch, you can see inferior alveolar, you can see it is going into the mandibular canal, and how it goes into the mandibular canal also you can see along with the inferior alveolar vessels. These are the branches from the trunk. Two. This is from the anterior trunk. You have buccal, which is sensory. This is motor, motor, and motor. So one sensory plus 3 motor from the anterior trunk. That means there is more of motor. Next one, from the posterior trunk, you can see ALI. So there is auriculotemporal, lingual, and inferior alveolar, which has 3 sensory. Along with that, it also supplies mylohyoid and anterior belly of digastric. So these two are motor. So 3 sensory plus 2 motor. This is a very important, combination that you must remember. So altogether, how many branches if someone asks you? So 2 here, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 branches. Okay, we have this Abdul saying Happy Doctor's Day. Thanks, Abdul, and wish you all a very happy Doctor's Day. And there is a nice, way to remember Doctor's Day because there was one physician. Actually, he was a physician. I think his name was some Raman, and he was the physician of Nehru, Chacha Nehru. So that's why we celebrate the Doctor's Day. So it started from him actually. So many times we don't know what is the root cause of some celebration or something. So this is the root cause of that. So we are celebrating his birthday, and so that is the story behind this. All right. Thank you so much and wish you the same. And then we have the sixth question, that is anterior wall of third ventricle is formed by. So now here there is an anterior wall and a posterior wall of the third ventricle. So anterior wall of third ventricle is formed by what? So third ventricle, you have a small connection to the fourth ventricle. Okay, so third ventricle, in the third ventricle you have tela choroidea, which produce CSF, cerebrospinal fluid. And we can talk about the options now. We have lamina terminalis as one of the option, pineal body, tuber cinereum, mammillary body. So anterior wall of third ventricle, what is it formed of? Think of which one. So lamina terminalis, pineal body. Pineal body is there, but it is inferior. Tuber cinereum is medially. This is inferiorly. And mammillary body is posteriorly. Okay, so this is almost in the temporal lobe. This is posteriorly present, and lamina terminalis is in the anterior along with the fornix and anterior commissure. So these two, anterior commissure, fornix, lamina terminalis, all are in front. So they form the anterior wall of the third ventricle. So you can see this is the third ventricle. So this is what forms the anterior wall. There is posterior and then there is inferior. This portion is inferior. So where you have this pineal body and you have optic chiasma, you have the pituitary, all this comes in the inferior most part. So you have anterior wall of the third ventricle is formed by lamina terminalis, anterior commissure, then you have the fornix. So this fornix is actually something that belongs to limbic system. Even mammillary body belongs to limbic system. So posterior wall is formed by the pineal body, posterior commissure, and cerebral aqueduct. So this is the cerebral aqueduct. So this is all the posterior portion. So at the back is all posterior. You can see the cerebral aqueduct here. You can see the pineal body, which will be a small projection from this side. That is a pineal body. So all this is posterior. And anterior and posterior relations of third ventricle, fourth ventricle is very, very important. Next, which of the following is true regarding the lateral geniculate body? So there is lateral geniculate body and medial geniculate body, which are actually part of the thalamus. part of the thalamus nuclei. So I have a YouTube video. I have YouTube videos which are on the neuroanatomy. So if you're not sure what is the answer, I would expect the students to go back, refer to the topics. So YouTube video, thalamus, hypothalamus, all this is put up just few days back. Please go back and see what is the answer for some of the questions that is put up here. So now all these videos you can access for free. You can also use this code for more access, Rohini. So with the code, you will have more free access to all the quiz and other stuff that has been put up. And when you want to subscribe, you also get this 10%. Don't forget to use the code at that time. And now the question is, which of the following is true regarding the lateral geniculate body? So remember that there is medial geniculate body and there is lateral geniculate body. I would always, even when I was a student, I always remembered the medial geniculate body as the middle ear. So this gave me a lot of, it removed a lot of confusion from my head. I would remember the medial geniculate body, middle ear together, and then I would remember this is with the auditory pathway. And the lateral geniculate body is with the visual pathway. So visual pathway, this is the auditory pathway. And then which of the following is true regarding the lateral geniculate body? It is connected to the inferior colliculus. Is this true? So we have to find the sentence that is true. Layers 1, 4, 6 receive the contralateral optic fibers. So they are talking about the contralateral optic fibers. Of course, they decussate. You keep that in mind. They decussate the fibers. Next one, it is situated posterolateral to the medial geniculate body. So where is medial geniculate body? Where is lateral geniculate body? Is it situated posterolateral to the medial geniculate body? Next, it could be true because we're talking about lateral geniculate body. It could be posterolateral. Is it overlapped by lateral part of the temporal lobe? Which one is overlapped by lateral part of the temporal lobe? Is it medial or the lateral one? So you have to remember that. So now here the answer is B. The layers of 1, 4, 6 receive contralateral optic fibers. Now this is true regarding the lateral geniculate body. So now here the lateral geniculate body is connected to superior colliculus. You should remember it is connected to the superior colliculus. So it is not connected to not inferior colliculus, not to the inferior, but it is connected to superior colliculus. The second one is it is situated anterolateral to the medial geniculate body. So what is the thing? Is it situated anterolateral? Here they say it is situated posterolateral. No, it is situated anterolateral to the medial geniculate body. Next one, it is overlapped by medial part of the temporal lobe. So here it says it is overlapped by lateral part. So it is medial part. See, temporal lobe is here and the medial part of the temporal lobe is closer to the thalamus, right? It is closer to the thalamus is medial part. So why will the lateral part overlap? Or lateral part is outwards, more closer to the cranium. So here it is the medial part what is supposed to be there. This is also not a correct sentence. This is also not a correct sentence. This is also not a correct sentence. So the only sentence, see, when you look at the options, everything looks right because there is very slight change in the options. So here instead of superior, it is inferior. So suddenly when you don't read the options properly, you may just assume that there is colliculus, so it is correct. But the answer was superior colliculus. It is not inferior colliculus. So such things you must remember. Inferior colliculus is way down. It is not very close to the thalamus. It is below. The superior one is very close to the midbrain. Okay, so this is the ones. You can see the different structures. We'll also see the colliculus superior and the inferior colliculus. You can see the optic chiasma, optic commissure, and optic tracts. You can see where the optic tracts go to. They go to the lateral geniculate body. They pass through the lateral lemniscus as well, and they pass through the lateral geniculate body. Okay, so this is, and then it is taken to which one? It is taken to, projected on to 18, 19 functional areas in the occipital lobe. Next, all are true regarding the femoral artery, except everything is true regarding the femoral artery except one thing. What is that one thing that is not correct about the femoral artery now? Everything is true. That one sentence we have to find out. It leaves the femoral triangle by passing through the adductor canal. Adductor canal is also called subsartorial. Subsartorial canal is basically for the structures in the femoral triangle. The femoral artery, vein has to be secured and passed on to the posterior aspect of the knee. So it is not seen in the anterior aspect, it is seen in the posterior aspect after it passes through the adductor canal. So this is the correct one. This is the correct one. Next, femoral nerve is lateral to the upper part of femoral artery. So femoral nerve is lateral to the upper part of the femoral artery in the femoral triangle. So is it lateral to the upper part? It's always lateral. So there is, nothing that you have to say it is lateral to the upper part. So this is also the correct, sentence only. Femoral branch of genitofemoral is lateral to the upper part of femoral artery within the femoral sheath. Femoral branch of genitofemoral nerve. So this is femoral branch of genitofemoral. This is one of the nerve from the plexus. This is from the lumbar plexus. It is lateral to the upper part of femoral artery within the femoral sheath. The last one is medial cutaneous nerve of the thigh. It crosses from the medial to lateral side. Now the question is, the nerve is medial cutaneous. Okay. The medial cutaneous, why should it cross? Why should it cross from medial to lateral is a question. Why do you think the artery should cross from medial to lateral near the apex of the femoral triangle? So apex is actually here. If this is sartorius, this is the other side, this is the apex. So from medial to lateral, why should it come? It won't come. So my answer, the wrong statement is the medial cutaneous nerve of the thigh crosses the artery from medial to lateral side near the apex of the femoral triangle. So this is the one. So femoral artery passes downwards medially, first in the femoral triangle, then it passes through the adductor canal. That is the first thing that we have said yes to. Then lower end of the adductor canal, it passes through an opening in the adductor magnus, and then it becomes continuous with the popliteal artery. So contents of the femoral sheath, if you take, where is the femoral nerve? There is lateral compartment where it has femoral artery and genital branch of genitofemoral nerve. Then you have middle compartment which has vein, and medial most compartment which has lymph node, which is called cloakwet. Okay, so this is the femoral triangle. And here would be the things, structures we are talking about. The medial most was the lymph node. Okay, this is the medial compartment. And the middle compartment is this one, which has femoral vein. And the lateral most compartment is this one, where there is femoral artery and the branch of genitofemoral nerve. But where is femoral now? It is outside the sheath. It is outside the sheath. It is not inside, it is outside the sheath, and it is on the lateral most side. But the medial most one, which is called medial compartment, is also having a small ring that is called femoral ring, which is guarded by two ligaments. One is the inguinal ligament, and also there is one more ligament. Inguinal ligament is also called the Poppert ligament. There is one more ligament that is called lacunar ligament. So these two actually guard the femoral ring. So you please remember, the lateral most compartment has the femoral artery and the genitofemoral nerve. It does not have the femoral nerve, it has the genitofemoral nerve, which is a branch of femoral, femoral branch of genitofemoral. So you have various mnemonics to remember: lumbar plexus. I'll be taking up all these things on the festival that's going to come up this weekend, that is YT festival. So please watch out for some of the mnemonics that I'm going to put up. So watch out for the important mnemonics that you can not forget ever. So for all this, you have to wait for one more day, and then please like and subscribe for all my classes. You go to this website, you go to this learners app, and then you see Row Aqua, that is my username, and you can also pick up for my name, Rohini YN, and you can follow, subscribe, and you can also use this code ROHINI to get 10% discount on your plus and iconic subscriptions. There are various options that it can suggest you. Please go and watch all those options and pick something that really suits your curriculum. All right, I would like to thank each and every one who was part of this session. And this is my referral code, or it is called the unlock code. It is ROHINI for all you YouTube users. And also there is one more code that you can use, ROHINI 10. And with these codes, you can access a lot of things, including the test series, quiz, PDF notes, etc. So don't forget to use the code. It is useful for you. And subscribe, like, and share is a must for you all, so that you get motivated, we get motivated to do better. And don't forget to follow me on my profile. Thanks everyone. You have a good